morning, KSA, and welcome back to the program. Of course, that was our Time to Focus, and today we're looking at the Karate Championships going on in Jeddah. It's a great hobby if your children like it. Why not get them enrolled in something like this? It's a great physical activity and also something they can find fun and entertaining, and it's a great method of self-defense. They might need it later on in life. But of course, today our main topic is about cellulite, something that affects many women and also men, although maybe men care less about it than women do. It's something that can really affect the way a person looks and can affect self-esteem, especially in the ladies. Let's find out more about cellulite and how or can we actually get rid of cellulite through conventional methods. Let's welcome Dr. Mohammed.alnasir, who's head of the plastic surgery department at the Saudi British Hospital. Good morning, Dr. Mohammed, and thank you for joining us once again.
Good morning. Thank you very much.
Dr. Mohammed, cellulite. If we can start just briefly by clarifying to the viewers exactly more about cellulite, what it is, and who gets cellulite, because me and Diana were talking about this, and there seems to be a misconception that only fat people have cellulite, only people who are obese have cellulite. Is this true or not?
Thank you. Actually, the word cellulite started in the English literature in the last century, in the 1920s. And it has become more popular in the 60s. And the first citation was in the magazine Vogue, and then started becoming popular among women. It mainly affects women, so it's not just the fat people. It affects
women more than men.
More like probably 4 to 1 like ratio.
Wow.
It's very interesting. And what causes cellulite, sir?
What causes cellulite? Hormones.
Hormones. Is it
like
genetically genes play?
Yeah, there are some like genes or genetics is a factor.
Okay.
But the main reason is actually hormone, or the main hormone, the responsible hormone is estrogen.
Okay, the women hormone. Okay.
So if we're gonna define cellulite, or I'm not sure if you have seen cellulite before, but it usually starts after the puberty. It doesn't. If you see like a girl, like if she's like 11 or 12, she can't have a cellulite. But
really?
For a girl who's 18 or 20 or 25, she will have a cellulite.
Absolutely.
So it's related to the hormones, to the estrogen. You'll have like this kind of dimple or dimpling appearance on the skin, which looks like the color or the shape of the orange skin.
That's true.
And that's why the reason for that in the body we have like the fat in 2 layers. We have a superficial layer and we have the deep layer.
Okay.
And we have fibrous septa between these layers.
Okay.
So if the skin loses its elasticity, so these fibrous septa will lose its tone, and the fat will collect in between these fibrous septa in pockets.
So creating
so this is the dimpling appearance. It's the fat globules in pockets.
Wow.
So it's a combination. It's not just the fat or the skin. It's a combination of both. So the skin has lost its elasticity, and the fat also has been collected in small compartments.
Which is amazing. But am I right in thinking that cellulite actually occurs in areas that contain more fat generally? So let's say for the women, the hips and the below the pelvic area, where those unwanted areas are there. And are these the areas that generally tend to get cellulite?
You are quite right, because this is the genoid obesity. It's mainly in women. It's mainly like in the pelvis and in the buttocks, while men is mainly in the trunk and the abdomen. And the other reason for that why you can't get like cellulite in the upper limbs, in the arm, for example, because it's related to the effect of gravity.
Okay.
So it's mainly like the fat will be collected at the most dependent part of the body, which is mainly like the buttocks, the outer thigh. So that gives you more cellulite. But you cannot find cellulite like on your shoulder, for
anywhere.
example. You got the point? So.
It's very interesting. And sir, of course, many people know that, or let's say it's very common known that sometimes with diet and exercise it can really help reduce the appearance of cellulite. Can you give us an idea about this?
Yes, diet. There are some dietary supplements. Low-fat diet will help.
Okay.
For sure. Some dietary supplements like ginkgo biloba.
Yes.
It helps.
Yes.
Antioxidants helps as well.
Okay, good.
Exercise. It helps to decrease stress in general.
So stress is a common factor.
Because like one of the causing theories is the causal relationship between stress and cellulite. And when people get stressed, and then they will have a high level of hormones in the body, which are catecholamines, if you know it, like adrenaline or noradrenaline when you get like stressed or something.
Exactly.
So if you get like into a program of routine or of exercise program, you'll be able to decrease this kind of stress hormones, and it will eventually lead to less cellulite. So it's an indirect effect.
That's good news.
Now, Dr. Mohammed, as we said, it affects women more, and it can be every woman's nightmare to have cellulite. But I've read so many different studies, and I just want to clarify with you that realistically there is no ultimate cure for cellulite. How true is this?
You're
Not
very
true.
right.
Not true. Please say not true.
It's true.
Yes, very true. Yeah, thank you. Actually, there are different therapeutic measures. As you have kindly mentioned, there are creams. The most popular is the Proselex and Revitol. But people will buy it and they spend a lot of money, and at the end they will get nothing. And the reason for that, there are no like what they call it like clinical trials or randomized clinical trials that will show like a causal relationship or like drug cure kind of effect. So it's quite variable. Like a lady will use this cream, she will say that, yeah, I've been cured or something. The other one will say it. So it's not really very clear, you know.
Absolutely.
Other measures would be like laser. Laser. Actually, I've started using laser for the last 3 years for treating cellulite, and presented a paper in the Brazilian Plastic Surgery Society, and it has showed very good effect actually on cellulite, which is not the external laser, like the laser which treat like the skin condition.
Internal.
No, it's an internal laser. Like we have the cannulas, and you have the scope, which will just have the laser effect on the tissue from inside.
So it's surgery.
Yeah, it's minimally invasive surgery. It's not like a surgery by like it's full term.
It might be minimal to you, Dr. Mohammed, but to me and Diana, maybe we're thinking surgery.
Yeah, I guess. Yeah, I mean, probably you can have it done like in the lunch break, because like it's like
Really?
yeah, it's
Wow.
it's under local anesthesia. So
Local, so it's not full
so
anesthesia.
it's not like general. You can come in. It's within 30 minutes. You will be.
Wow, so you can
back
have
on the road.
a lunch break fix,
Yeah.
almost. But how many laser sessions or how many lunch break fixes does one need to actually reduce the appearance or eliminate?
Yeah, for lasers, maximum is 1 or 2. Like 2 would be like the maximum quota. But
To reduce the appearance?
Yeah,
But not to eliminate.
I mean, I won't say eliminate, but it would be like the maximum effect you will get is from laser.
Wow.
Like, the second therapeutic measure is the mesotherapy. I'm not sure if you know what's mesotherapy.
I've heard of it, but if we can maybe tell the viewers a little bit more about
therapy is
it.
mean treatment in general, and meso is like is the measure of treating the human body by injecting special products under the skin.
Okay.
In the subcutaneous tissues. So there are some, if you hear about meso hair or something, so there are special drugs, special components you will inject to help the hair proliferate or grow. And the same thing for the fat. There are some lipolytic agents which you inject, and it help reducing the amount of fat or the fat globules. So it helps, but its effect is less than laser.
And it's a long-term treatment, of course. You need to have more than one session, I assume.
Yeah.
How many sessions are we looking at?
For mesotherapy, probably it's 4 or 5 sessions.
4 or 5. And just on that note, just before maybe Diana moves on, how expensive or how inexpensive, I mean, what's the cost of these procedures, maybe the laser, and also people watching us at home, and maybe many of the women would like to find a solution other than the creams that are not 100% effective?
Yeah, probably you've answered the question indirectly. I mean, the cost of these modalities are actually less expensive than creams.
Really?
Yeah.
Wow.
I'm not sure if you bought a cream in the past for cellulite.
I don't have cellulite.
If you have a friend who bought a cream. But it's a very expensive cream. It's very expensive, and you have to rebuy it.
Absolutely, absolutely.
But I mean, the cost of laser, if you're going to calculate the cost like of laser therapy as well as mesotherapy, it will be less expensive than creams, and you'll get a better effect.
Okay,
very
so it's more
interesting.
cost effective on the long
Yeah.
run if you look at results in point.
But sometimes the media will be misdirecting people. They're saying that, I'm not saying about TV, but I mean in the journal something saying that there are creams or treat cure cellulite. It's mainly ads, and people will go behind these ads and buy things. And by the end they will spend a lot of money on getting nothing. But scientifically, I mean, the laser has been shown like a very good progress in cellulite treatment as well as immunotherapy.
Wow.
There are some non-invasive measures, as we mentioned, which you can treat at home as like exercise, massage and spa help. I mean, and the reason for that is just the activation of the blood circulation. There's nothing else. I mean, you know, that's what.
So we spoke about this earlier, me and Diana. They're assuming that the creams. I mean, there's all sorts of creams available, and I'm sure Diana would agree. The creams that contain like a ball or whatever, all these different types of creams,
particles,
actually work on massaging the area. So you assume, or the person purchasing the product assumes that they've gotten an effect because of the chemical compound, but it's actually the massaging of the area that has helped to smoothen up the cellulite a little bit.
Yeah, sure. And the thing for that, I mean, the fat, if you're looking at the skin, I mean, there are 3 layers of the skin. I'm not sure if you know, like the histological composition of the skin. You have the epidermis. Or the epithel. And then you have the deeper layer, which is the dermis or the derm, and you have the subcutaneous tissue. So if you're going to apply any kind of cream on the epidermis, it's very hard for this cream to reach the fat.
That's true.
So that gives you an idea. I mean, these kind of creams, it doesn't really work. So the reason for that, it doesn't really reach the target area. You got the point. So.
Absolutely.
That's very interesting. And okay, so just very, very briefly, just to recap for the viewers, basically these anti-cellulite creams do not really work.
And there are no studies.
There are no studies to back the evidence or the proof that they do work. And very importantly, diet and exercise, let's say, is the best way to prevent or to reduce cellulite. And of course, you also got the laser treatments that you probably need a session or 2 or more, depending on the type. Now, very important question, sir. You've clearly mentioned that these laser therapy are very effective as opposed to other alternatives, and you mentioned that there are cases, let's say, they might reduce or maybe eliminate. But so how long these effects last? I mean, do you have to go back again after a year or 2 years for more therapy, or I think is one session enough for a lifetime?
For the laser? If you just for a teaching point, I mean, if we know what laser is, laser is like it stands for light, so it's like 5 letters. Light, A for amplification. Light amplification by stimulated emission of radiation. So it's a light which has been, and you have the radiation. So this light will act on the collagen, and it will help the collagen to be remodeled. And this will take time, as you have mentioned. That probably it's like in a year's time or something. Normally the collagen will be remodeled in a year's time. So probably if you have like a laser session in a year, probably you'll get like 1 or 2 laser treatment. That would be enough. You know? For the mesotherapy is something else. So probably you need to apply it frequently. Probably we need to like 4 up to 6 sessions with 1 month interval.
Okay, that's very interesting. And very importantly, you also said that, sir, that usually women or girls after puberty are more likely to get cellulite. Just give us a brief idea, sir. From what age group do you see women having more cellulites?
Here in the Western society, I used to see women after 35.
After 35,
in Saudi, I see women after 25. The reason for that is the lifestyle. Like the Western ladies are mainly very keen to have like exercise, like
very active,
like at home or
or even walking outside, for example.
But I'm not talking about just Saudis. Only the Arab ladies. I mean, they are not very keen on exercise, and this is probably the reason for that.
That's interesting. I think.
I mean, all women. I mean, are
absolutely.
And I think stress is also
in the region
key factor when it comes to. So what about, let's say, other factors such as smoking and the heavy kind of food that we usually have here in the Arab world?
Unhealthy food.
Unhealthy food, basically, yes.
Unhealthy food.